So again, I'd like to introduce to you someone who's going to give us an update on the research projects that the money that we've been raising has been used for. Let's have a hand for Dr. Sabine Muller from the University of California.
So good evening, everyone. It's really a pleasure and an honor to be here tonight. But this is really not just work for myself. This is really a whole team approach. And in order to show you this, I really invited all my colleagues, Michael Prados, Javad Nasserian, James Pyle, Cassie Klein, and Adam Resnick. And these are just a few members of our team that we were able to establish over the last year. We have members, Jason Kane from Australia, Marilia Philbin from Boston, Eric Raab from Johns Hopkins, Nick Ventanza from Seattle, and then Karl Korschmann and Andrea Frenzel also from the University of Michigan. And we really came together as a team to try to make a difference with this disease. And that is based really on an experience I had here 2 years ago, and what really affected me quite deeply was really the words from Mina at that ball when I was first here and had the privilege. She kept saying, and many of you might remember that because it really emotionally impacted me when she said, we have to do better. We can't just continue not making a difference for this disease for decades. There's been no approved drugs for this disease. We haven't been able to change the outcome for this disease really since many, many years now. And her words really stuck with me that we have to do better. And in some of my personal decisions also, I had the opportunity to actually move to Switzerland to develop a center just focusing on diffuse midline gliomas, DIPG, together with my colleague, Dr. Nasserian. And it's obviously a big decision to move your whole family to a different continent. But I kept hearing these words, we have to do better, we have to do better. And that really created something very special. So I wanted to thank you for that. So we are really trying as part of this research effort to do better by breaking down the silos, by sharing results in real time, by discussing problems we face. And I just wanted to give you one example. So I talked to Mina about the project, and I said, this is really a very close collaboration about scientists working in the laboratory on models with DIPG. But then also we, from the clinical side, want to quickly take any exciting findings to bring it to the patient. And I basically said, I think, the trial will be open January 2020. The results look good. But then we discovered in the lab that actually the results didn't quite match, and we had conflicting results. And I wasn't sure anymore if that's actually the best therapy we can move forward. And so I felt obliged to talk to Mina and say, maybe the trial will actually start later, and I'm sorry, and I fully understand if you don't want to support us. But what she said, and that is just amplifying really how she thinks about this disease, she said that's exactly what this is meant to do, that we are really thinking and working hard together to bring the best therapy forward. And if it's not the right one in this moment, we will work harder to find it in the next moment. So I really wanted to thank you for that wisdom, because not all of the people have that. But I will let my colleague, Dr. Nasserian, talk a little bit about our exciting project. And I had some conversations earlier today. It is a devastating disease, and we haven't made much progress, but we learned a ton over the last just few years about the underlying biology, what's driving these tumors. We have model systems now. We establish great collaborative teams. And I feel it. I'm so hopeful that this will really translate soon into better therapies for our children. And obviously, we couldn't do any of this without your support. So I really appreciate that you join us in this fight to make a difference for these children and families. Thank you.
Ladies and gentlemen, there are more scientists and clinicians standing on the stage here tonight with a focus on the IPG that we had in an entire country 10 years ago. This is purely because of the support of the family and their friends, like you all tonight. Thank you very much for your support. The work that Dr. Muller highlighted out in Zurich has been also, as she mentioned, has been supported by the help of the families and foundations. And we could not have been able to do the work without the support. If you go to the NIH, to the National Institute of Health, or the NCI, and say that we have a great idea for a disease that is deadly, that is spread among different laboratories, it would be impossible to get funding from the NIH. Our friends and congressmen hopefully will try to change the status quo for the NIH to provide more funding for the pediatric brain tumors. But the type of work that we do for a disease that is very deadly, and for the time period that we have only 9 to 12 months from the time that a child comes in. We need to have a different level of expertise and a different level of commitment that the government and NIH does not support. The government and NIH wants large clinical trials with thousands of patients of a disease of adult. Pediatrics have been unfortunately neglected. We are purely funded. My laboratory in Washington, D.C. and in Zurich is 100% funded by families and foundations. Thank you for the support. The work that we are doing in Zurich, the idea has been to bring 8 different laboratories from Australia to Europe to United States to work together and share data live. We have calls every 2 weeks. We don't care about publications. We don't care about IPs. We don't care about securing NIH funding. We share the data, but the idea is that for us to serve the clinic. My colleagues in the clinic see the patients. They want to do something. They want to change the status quo. The fact that Neil Armstrong's daughter was diagnosed 58 years ago with the IPG, and kids who are diagnosed today are receiving the same treatment that she received 50 years ago. The clinic wants to change this. Dr. Muller wants to change this. It's my job to help my other colleagues who are doing research to bring the next medication, the best medication that works, to the clinic. And I can't do it without the support of the families. So thank you very much, Mark and Mina. Thank you very much, all of you, for your support. Thank you.
How about a nice big round of applause for Dr. Sabine Muller and the rest of the team, the whole team here tonight.